Good afternoon, everyone. I'm sorry I'm a few minutes behind schedule, wrapping up with patients at the clinic, as well as completing some time here, going over some details with some participants in the legacy program. So I'm going to give a few moments just to wait for a few people to hop on. Again, my apologies for running behind schedule. So if you catch this on the replay, please do leave some comments, questions. I'm going to be sure to go ahead and drop information into um, the chat just about where you can find more information about the legacy program. And I will do that just throughout the time that I'm speaking here and discussing. So hopefully you guys have had a wonderful Friday so far. Happy Good Friday. It's been a pretty amazing day here at the clinic seeing patients, both virtually and in person. So today I wanted to hop on and talk about why it's so important to have individualized care. I think just personally, what I see with patients and clients is that we have plans, we have um, different protocols that are in place that we use in a blanket manner. So, for instance, if you have acid reflux, X, Y, and Z is what you get. Like, that's just a part of the protocol that is specific for um, XYZ specific diagnosis, right? Um, but just going through the process of seeing clients over the last decade, being able to shadow and be an intern with clinicians during my time in undergrad and in graduate school, seeing that obviously each person is dynamic, each person is different, each person has their very own trials and tribulations that they experience. And so all of those factors has to be taken into consideration. And so when we see, three, four, five people present with the same diagnosis, um, as clinicians, we should not um, just stay with the basic protocol. Like we absolutely have to diversify our approach to each of those individual clients. So, for instance, there might be someone who has been diagnosed with high blood pressure, and that person is having a bit more stress than typical. So, implementing meditation, implementing yoga, other self care modalities that have been shown to support the parasympathetic nervous system are going to be important for that specific client. Or we might have another client who has hypertension, who is sensitive to sodium intake. And so for that client, we want to be sure that we are monitoring, but also making valid and appropriate recommendations around diet, right? Know that it's going to move the needle for them as far as being on a more um, positive findings and positive results. So again, individuality and care is important. Being able to have a diverse care plan, treatment plan is going to be important. And it's not just for the importance of the client per se or the doctor, but it's going to be important for the long run. It's going to be important for getting actual results that the patient will be able to see because we're approaching their case from a holistic approach. And I know that's cliche as far as holistic, we're looking at the whole person. But when we do that and when we approach each of those different facets of that person, we're able to make huge, impactful changes and differences. So, again, if you are here, just leave a comment. Let me know where you're chiming in from. Um, Let me know if you think individualized care is something that you would love for yourself. And then if you are currently experiencing care that includes individualized care, specific approaches to you as a whole person, drop that in the comments too, because I'd love to see who's experiencing that and how that's been impactful for you. So once more, I appreciate you guys, appreciate your patience. It's been, I know it's still early in the day, but it's been quite busy day. And I did want to just hop on, chat a little bit, and discuss why it's so important for each of us to have individualized care, and that you can most certainly get that individualized care through the legacy program if you are and have been diagnosed with high blood pressure and you're motivated and ready to tackle the core issues as it relates to high blood pressure and get that plan that's going to move you in a positive direction towards healthy goals that you're looking for. So, as promised, I'm going to drop the link to the legacy program and where and how to get more information on it in the comments. And so you will find that information in the comments there. And if you have any questions at all, or if you're interested in moving forward and getting more information about the legacy program, check out that link. And if it resonates, send over an application, and I'd be more than happy to go ahead and get you on a clarity call to see if this program is a wonderful fit for you. All right, again, take great care. Um, Happy Good Friday, happy Easter, and I will look forward to checking in with you guys very soon. I think because we had gotten off schedule last week, I will be on again next week. So mark your calendars and hop in the comments and yeah, show some love. All right, take care, guys. Bye bye.